We have an exciting day of great information. And if you're like me, I know you're ready to take every bit of it in. So in order for us to get started, we have to hear from the right people in the room to get us kicked off. I'm going to ask that Evelyn Bryant, who is the Board of Directors President for the YWCA of the Lower Cape Fear, if she'll come forward at this time, followed by our very own mayor, the Honorable Bill Saffo, who is the mayor of the city of Wilmington, who I believe is probably the best looking mayor in the country.
Good morning. Can I get a little bit livelier? I know it's early and we're here the majority of the day. Good morning. Good morning. Yes. On behalf of the YWCA Lower Cape Fear, welcome to our first annual Health Summit. I am Evelyn Bryant, President of the Board President of the Lower Cape Fear YWCA. Today we come together to empower and build healthier communities. We are proud to host this summit as we recognize and address health disparities in our community. You will hear from a host of incredible speakers who are experts in their fields working to advance health equity. YWCA has been working towards racial equity and social justice for 108 years. They've been at the forefront of the most critical social movements, including healthcare. We know that a healthy life requires systematic change to close health disparities, and what influences a person's health relates to more than just physical being. I would like to take this moment to thank our incredible partner, UnitedHealthcare. UnitedHealthcare contributed funds to move forward YWCA's work to eliminate racism for developing and executing a health literacy campaign targeting women and BIPOC communities. The focus of the campaign is on reducing the prevalence of health risks linked to common causes of illness while increasing overall health literacy in historically and economically disadvantaged communities. Thank you, UnitedHealthcare. I would also like to thank our sponsors of this event, Wilmington Health, AARP North Carolina, North State Bank, Cape Fear Collective, and Emcee Project Lead. It's organizations like you that allow us to continue making a difference in the Lower Cape Fear. Thank you to the YWCA Board of Directors, YWCA staff, and Health Summit Committee for your time and dedication to the YWCA mission and this health literacy campaign. And before I move on, I'd like to introduce to you our next YWCA president, Lauren McConville. Lauren, can you please stand? So as past board president of the YWCA, I've enjoyed my reign, but I will continue to bleed the blood of Princeton, which is chrysanthemum, which is the color of the YWCA. So at this time, I'd like Mayor Saffo to come forward.
Well, good morning, everybody, and it's a pleasure to be here. Thank you to the YWCA for putting this summit together. I'm just going to tell you something that my grandmother told me. I lived to be 101 years of age. She says, you can have everything in the world, but if you don't have your health, you have nothing. And that's something that we need to always take in consideration. I know several years ago, myself and Evelyn and others were involved in a health evaluation of the north side. It was an area of town right here that we saw high rates of diabetes, heart disease, strokes, you name it, it was there. And what we found was that there was a lot of people that were not getting the proper health care because they didn't have the equity there that others have. But we're not only seeing it on the north side today, we're seeing it all over the community. And we're also seeing it all over the state. One of our jobs with the city is to continue to look at ways that we can manage our healthcare costs because they continue to explode, especially with diabetes, hypertension, just heart disease. And we continuously have to work to manage healthcare costs every single day to try to keep them under control. And I know how hard that is with 1,000 employees. I can't imagine what it would be with several thousands and thousands of people that reside here in Hanover County, the city of Wilmington. So I appreciate this summit coming together, this first summit, to determine what are the discrepancies and then in the inequities in health in our community. I think it's very important that whatever comes out of this summit, that there's be some kind of a plan of action that we as elected leaders, which is the city, the county, Novant Health, and others, take action and start working on a plan to help to reduce those social things that are making people, not allowing people to be healthy. It's extremely important to all of us. And it continues to be a problem and will continue to be a problem unless we all work collectively together to try to reduce those costs and improve the quality of health care in our communities, and to make certain that those folk, the citizens and residents that do not have adequate health care, get it. So I want to say thank you to everybody for being here. It's a great city to be the mayor of. It's a growing and prosperous city, but we definitely have our challenges as elected leaders and as citizens to make sure that our fellow citizens also have the same choices that we have to get good quality health care in their communities. So God bless you. Thank you for allowing me to be here this morning, and have a great conference. Thank you very much.
Thank you so much, Mayor Saffo and Chair Evelyn Bryant. We certainly want to acknowledge, if we have any other elected officials with us this morning, if you will stand at this time. Are there any other elected officials? All right, and I can't really see because of the lights, but I would assume that I don't see anyone standing. Let's give them a hand again for being with us this morning. The best way to find an inequity and to solve it is to acknowledge that there is one. And your presence here today speaks volumes to the fact that you realize there has to be a change in the area of health care. For our plenary session 1, Transforming Communities for Health Equity, our presenter, we are so privileged to have her this morning, is Elisha Rhodes, the Chief Operating Officer of the YWCA USA. Ms. Rhodes is a leader, a movement builder, and a change maker. As YWCA USA's Chief Operating Officer, she effectively stewards official resources to support a federated network serving over 2.4 million women and girls each year. Ms. Rhodes plays an instrumental role in streamlining operations while playing a leadership role in spearheading strategic enterprise-wide initiatives, such as the Strong Foundation Fearless Future Initiative, the Strategic Business Plan, and successful oversight of YWCA USA's operating budget. She regularly plans regional, national, and international events for the network and strategic partners. Ms. Rhodes was recently invited to join the Forbes Nonprofit Council. Her leadership continues to garner recognition from national and international institutions. Ms. Rhodes also serves as the Chief Diversity Leader for Leadership 18's Executive Committee. Ladies and gentlemen, put your hands together for Elisha Rhodes.
Good morning. So before I get started, I just want to say that Miss Rhodes is just Elisha. And she's just a girl from Brooklyn who looked out the window this morning and tried to figure out, how did I get here? What am I going to do? And why are these folks listening to me? So I want to thank you, Velva. I want to thank you, Evelyn, the entire board of YWCA Lower Cape Fair, the entire staff at YWCA Cape Fair, which I consider my people. I started out at YWCA USA 16 years ago as the administrative assistant at the front desk. And I've grown in the organization from the admin to the interim CEO to COO. And that is a testament to the power of collective action, the power of a sisterhood, a movement, and literally as we think about health inequities and we think about what transformational change is, I want to just start off by saying, if you are unsure of what it looks like, you can take a good look at me and you can see this immigrant girl from Bed-Stuy, Brooklyn, with limited resources, that transformational change happened at YWCA within a community of 200 local associations with amazing leaders like Velva and folks across the country who said to me, I did not have to survive, I can thrive. And I can thrive because we're in community and partnership with each other, and we're gonna show up for each other every day. So before I go any further, I wanna give just 5 seconds for you to give each of yourselves a round of applause for showing up at 8 a.m. this morning to not only be here for your communities, but be here for yourself and in support of YWCA Lower Cape Fear. Now, I talked about thanking Velva, and before I dive into keynote, and I'm gonna use, as I told Velva this morning, this keynote term very loosely, I wanna just center a community of ours, a community that remains in mourning and grieving. Over the weekend, our community in Buffalo, New York, lost 10 folks senselessly to the hands of yet again another hate crime. Another crime just because of who they are, what they look like, and where they live. And it's really hard to get through any moment without centering the grief and the pain that our sister communities across the country continue to face, even our communities in Southern California. So if you can just take a second to just spread some virtual love to our sisters in Buffalo and just across the country who show up every day to do the work, who continue to be triggered by the things that happen in their community, and the things that are happening are not in isolation of each other. We may not think that hate crime, that crime because of the color of a person's skin, has a lot to do with health inequities, but I guarantee you that when you leave here today, you will see the intersectionality of all of the crimes, all of the disadvantages that we have to face as communities of color intersect with each other in a way that we can and we will make change for our communities. So if you think about our sisters in Buffalo, we think about our families, we think about our sisters across the globe. I just want you to remember that nothing is in isolation. We are operating within a system that has been created for centuries to disenfranchise communities of color. And as we think about health inequities today, we'll see that health inequities did not start with COVID-19, right? We talk about it a lot. The CDC now talks about it a lot. We've declared public health, racism a public health crisis, but these are things that we've known exist for many years. Way back to the late 18th centuries when W.E. Du Bois mentioned in his book, The Philadelphia Negro, the health disparities against Black folks compared to white folks, right? When we think about all of the reports that have been published for many years by the public sector, by the private sector, talking about health disparities, and we still wake up in 2022 trying to figure out why our kids are living the lives that they live, why big corporate companies are targeting our kids in their advertisements 10 times more than they are certain communities. We talk about hypertension, diabetes, but we can't ignore that these are systemic. These are part of a structure that has been created. And we oftentimes talk about a system that is failing us. I love public officials, but I don't think that our system is failing us. I think the system is working the way that it was designed. It is not a failure. It is one of the most well-run machines that I've ever experienced. So instead of focusing on system failures, we need to focus on how we dismantle the systems that were created with us, people of color, not in mind, to rebuild and reimagine a world where there is equity, where we're not afraid to go to school, to play, where we can go to the doctor, we can have access, And not only can we have access, we can have access to good care. As I thought about how I was going to show up, and let me just be really clear, I got a lot of notes, a lot of papers, and I've not looked down once. So if I start rambling, just hang in there with me. I was thinking about how I'm going to start off today. And I thought about my mom. I thought about how my life intersects with so many of the things that we're going to cover today. I thought about how I don't feel qualified to be here because I'm still struggling with my own health inequities. I'm still struggling with my own trauma. I'm still struggling every day to show up as a whole person. My mom didn't raise me. My mom and I parted ways when I was about 1.5 years. And we did not reunite until I was a teenager, and I did not understand why. And you can imagine as a teenager reuniting with your mom, there was a lot of anger, abandonment issues, a lot of things that I had to carry with me. And I made a promise to myself, because you couldn't tell me I wasn't the smartest teenager in the world, that I was gonna get as far away from my mother as possible, because I knew my mother hated me, because my mother did not love me. And I could not figure out why. I carried that pain and I carried that hurt all the way to the YWCA, which I said was that place where I found love, I found purpose, and I found a different meaning of how to show up. And I was talking to my colleague Cherie last night about a message that she sent me about 2 weeks ago or 3 weeks, probably about a month ago, that I didn't respond to, and it was a message of love, telling me that she knows I'm going through a lot and she's here for me and she sees me and she recognizes me. And I couldn't even respond to Cherie. Not because I didn't appreciate it, but because every time I opened that message, it made me cry. Because even in my late 30s, it is still hard for me to receive love. And you may wonder what that has to do with health inequities. When my son was born, my mother and I started to rebuild our relationship. And I learned from that moment of processing why my mother did what she did. It was because my mother had to make some choices that she shouldn't have to make. Should she care for her toddler child, right? Or should she sit at the bedside of her dying mom to make sure that she received the appropriate care to extend whatever life was left in a comfortable way? Or should she maintain her employment? And my mom, with those 3 really hard choices, chose to go to the hospital every day to sit next to my grandmother's bedside as she aged and as her health deteriorated. My mother couldn't care for me. She couldn't drop me off at daycare. She couldn't pick me up. Many times in that 1.5 years, she left me in the house by myself, thinking she was running to the hospital and come back, but never made it back and had to call a neighbor to watch me. That is something that I did not understand until 12 years ago when we started to rebuild our relationship. It's also a story that we now have to hear every holiday, not because my mother is stuck in the past, but because it's a burden that she continues to carry. Every time she looks at me, every time she feels like she's disappointed me and she hasn't been there for me, there is a constant reminder of, Elisha, I did not do this because I did not love you. But I grew up in a world that normalized those actions. So when I was able to leave and go to college, I said, I'm never coming back. I'm never coming back. I don't care. My mother hates me. I don't want to be in the house with her. And you can imagine at 18 years old, I made a lot of bad decisions, thinking that I wasn't loved and I would rather be anywhere in the world than with my own mother. Society would have us believe that the problems that we continue to face are individual problems, that there are problems surrounded and based on decisions that we make as individuals, we make as people of color, that if we act right, if we talk right, if we walk right, if we breathe right, that everything will be all right. And what we know for certain is that is not the case. That is not the case for so many people of color. It doesn't matter what we look like, what we wear, how we wear our hair, where we go to school, if we go to school or not. Before we can even say mommy or daddy, our futures have been determined for us. The lack of access has already been assigned to us because of the color of our skin. The lack of access has already been assigned to us because of our immigration status, because of who we love. God forbid we're an LGBTQ community member and a Black person and a woman. Access continues to shrink. Our jobs, our responsibility, something that I consider my purpose, is how to dismantle that notion that says because of where I look, what I look like, where I was born, and who I was born from means that I am not worthy and I cannot have the access that I need to survive. Now to my notes. So I talked about how this notion of health inequities isn't new, right? I talked about how after COVID, we started to really think about and normalize conversations about health inequities. They came from within the four walls of public health institutions, and they became larger conversations. They became conversations that the CDC wanted to participate in. They became conversations that we can hold conferences around, but the problems were the same. They just exacerbated because of COVID. I think it's also important to note that while we see the future as one where all communities can thrive, we cannot see that in isolation of each other. The problems that we're going to solve for, and we are going to solve for these problems one way or the other, aren't problems only because of medical institutions. The problems that we're going to solve for requires every single one of us to show up and show up every day for each other, our neighbors, and our communities. Centuries of racism have created deep inequities in housing, income, healthcare, education, public transportation, safety. I have a 12-year-old son. He just joined middle school. We were the middle school and the elementary school are 10 minutes apart. Same zip code. The access to health resources he had in middle school, in elementary school, no longer exists in middle school because of a 10-minute drive, right? Because the community that he's now in middle school looks a little darker and a little browner, right, than the community that he was in elementary school. Make it make sense. It makes absolutely no sense how drastically access changes because of where we live, right? We want to think that, we can live in a world where everything is going to be okay, that we determine if we survive or if we don't. The reality also is, depending on where you live, is a greater deterrent on whether you will live and how you will live than your family medical history, than where you went to school. So if there is nothing you can do, right, because you were born into a community, there's a death sentence on your life. Whether someone is shooting you up in church, in a grocery store, or whether someone is saying to you, you have a headache as a Black man, but you should be okay, right, because it's just pain, take a couple of pills, right? You don't need any type of evaluation just because of the color of your skin, because I can be late to a doctor's appointment and the doctor determines without even saying hello to me that I'm late because I don't care about my own health and therefore he doesn't. But someone that looks different from me is late, but is given the benefit of the doubt and a glass of water because they had to be running late because of traffic, right? These things may seem minor, but these are the barriers that our communities face every single day. Every single day. My mother lost her dad because he hit his head and he refused to go to the hospital. Because he said he wasn't going to the hospital because the hospital was going to kill him anyway. Anyway, my husband, in 2022, I have to argue with him why it is important for him to trust the doctor. Why it is important for him to go to the doctor for his annual physicals. And this is a man that lost both his grandfather and his father at the age of 42 because of heart disease. And the barriers continue to stack against us as a community. That even though we face this loss and this grief, we feel paralyzed. We feel paralyzed because we don't have these conversations enough, because we don't normalize talking about the problems that we face in our communities. Neither do we stay in deep community enough where we're driving towards solutions. We know that women of color continue to hold the brunt of COVID-19. We know that we continue to deal with the she session. We know that we're still grieving Buffalo, George Floyd, Breonna Taylor, and so many others. We see our kids go to school with limited resources and be immediately placed in the school to prison pipeline. But what we sometimes forget to acknowledge is that every single one of these issues are related. They're related because they're part of a system that has been designed to continue to disenfranchise us. Recognizing the connectedness between our nation's history of racism and these current day racial inequities, YWCA USA and many of our local associations across the country, including this amazing, bold, and fearless local association, YWCA Lower Cape Fear, have been a driving force in advocating policymakers to recognize and address racism as a public health crisis. There's a growing consensus, as I previously mentioned, that health experts, researchers, scholars, medical practitioners, and elected officials have recognized that something needs to change and something needs to change immediately. The factors range, like I mentioned before, from healthcare, employment, food insecurities, etc. One thing that I promised that I wouldn't leave here without saying, I promised this to Cherie last night, is I don't care what words you put to it, right? I don't care if we call food insecurities hunger, right? We went from being poor to poverty, right? Housing deficiencies to homelessness. We can change the words over and over and over again. It is the same thing. And we're operating in the same system. These social deterrents of health are beyond interrelated, and they've been shaped for decades. Our social economic policies, our legislation in itself, federally and sometimes on a state and local level, we love you, Mayor, are deeply rooted in racism. Not today, not yesterday, but for generations. Access to care remains a problem. People of color and immigrants are less likely to be insured and are more likely to live in medically underserved areas. And this is not by choice. Remember redlining, right? We didn't really have a choice where we live, right? And we still don't, because many of those policies still exist in Washington, D.C. Many of those policies are still being acted on in our local banks. Look at what's happening with Wells Fargo, right? We may feel like we're really far away from those moments and times, but we're not. We just don't talk about it enough, or they change the names to confuse us. We don't live in these communities because we all got together and say, hey, we want to be here. We live in these communities because we are forced to live here. And in being forced to live here, we've given the government and other stakeholders and decision makers an opportunity to say, we're not going to fund you the way that you should. If there is nothing else that we do today, and I don't mean to be the bearer of Debbie Downer so early in the morning, I want us to leave here understanding that transformational change starts from within. Transformational change does not always start in Washington, D.C. right? If we wait for Washington, D.C. to change policies and laws, we'll be waiting for another 100 years. We have the power collectively to make changes. Our state and local officials have the power to make changes. Those are the folks making the decisions that impact our lives on a daily basis before we could even talk about what's happening in Washington, D.C. So if we're going to do anything to change the lives that we live, if we're going to transform our communities, we have to start with each other. We have to start with holding each other accountable. We have to start by getting familiar with who is on that ballot for council member, who is on that ballot for school district leaders, because that will decide whether or not our kids have access, whether it is the appropriate medical or mental health access in schools or access to books, what our roads look like. It will determine what the beautiful mayor said about having a local official or state official that is intentional about looking at the cost of health care, not when it's time for elections, but on a daily basis. And recognizing that my lack of access isn't because I'm a lazy Black woman or my brother is a lazy Black man. And understanding the systemic racism that plagues every single part of our existence and every single part of our systems. So as you continue today, I want you to take some time, if you haven't already, to get to know the people around you, get to know what they do, get to know what makes them happy, and get to know how you can stay connected. Stay connected on LinkedIn. We can help each other. We are all we have. The power is in the collective. And I want to thank each and every single one of you for showing up in the collective today for our communities, for ourselves, and in support of YWCA Lower Cape Fear. Thank you.
Thank you, Elisha. What a powerful opening session for us here that gives us all something to think about.